third of the vaccine given to adults, and the results were promising immune responses. As hopeful as a looming vaccine for kids can be for some, it's also a little scary. Lots of questions about COVID-19 vaccines for kids, not to mention managing the stress that comes with the situation. Today, we've lined up a couple of pediatric experts who can get us up to speed on some of the latest research into COVID-19 vaccine for kids and how to talk to your kids about vaccinations. They've agreed to take your questions. So give us a call with any concerns you have about getting your child vaccinated. Are you trying to find certain information but haven't had much luck? Maybe you're looking for some advice on how to have conversations with your kids about vaccines. Give us a call. We're at 1-800-716-2221. Our email address is bluesky@cbc.ca. You can tweet us at blueskycbc. And we're also live streaming today's show on the CBC Saskatchewan and CBC Saskatoon Facebook pages, so you can ask your question in the comments section. And again, our guests are here today to share the latest science on this issue. They're not here to debate what you saw on Brand New Tube. So with that, again, our telephone number, 1-800-716-2221, or email bluesky@cbc.ca. And if you're following along on our Facebook pages, just put your question in the comments section. We'll get to them as quickly as we can. Our guests today are Dr. Ayisha Kurji and Dr. Madav Sarda. Dr. Kurji is a pediatrician and assistant professor of pediatrics at the University of Saskatchewan. Dr. Sarda is a child psychiatrist. They're both based at the University of Saskatchewan. They were both part of a virtual town hall last night about COVID-19 vaccine for kids, and we're pleased to have them on the line now. Dr. Kurji, thank you so much for your time.
Thank you so much for having us today.
And Dr. Madav, thanks again for joining us.
Pleasure to be here.
I'll ask you each in turn. I'll start with you, Dr. Kurji. How did that town hall go last night?
I think it went pretty well. There was lots of questions, lots of detail in the questions. Shows that people are, I think, trying to find the right information out there. So I was really happy to be able to be part of trying to provide some correct information, and hopeful that parents are feeling positive towards getting vaccinated and getting their kids vaccinated in the future.
Dr. Madav, what was your thoughts?
I agree. I think it was a great town hall, and I don't think we even got through half the questions that were posed. Unfortunately, I think there's still lots of questions that people have, and hopefully we can address a few more today and keep this process going into the future.
Dr. Kurji, what were the most common questions or concerns raised last night?
It's a really good question. There were some questions about how vaccine is going to roll out for this age group, which we don't have a lot of information about. There were lots of questions about side effects of the vaccine, specifically things like disruptions to the menstrual cycle in girls, the myocarditis risk in boys. Those were some of the ones that came up. And also, if kids generally do well with vaccine.
5 to 11 age range received about 1/3 of the dose that the full adult dose was.
Now, Dr. Kurji, what does some of the latest research say about side effects in children?
So far, it looks like this is a really safe vaccine. I know that Health Canada is one of the strictest bodies in terms of approving vaccines. So I know for me, that provides a lot of reassurance that if they approve it, it is generally considered safe. Side effects should be really similar to what we see in adults, where most of it is local redness or swelling at the site, maybe feeling a little bit tired or achy, maybe a bit of a fever. What's different in what we saw in the teenagers is really that myocarditis piece that's come up a little bit, which we can chat a little bit about now if you'd like. Myocarditis, what it is it's inflammation in the muscle in the heart. We're not really sure why it's more common in younger people. And it's, adolescents and young adults, specifically more common in males than females. And that's what we sort of saw when the vaccine rolled out in the older kids. We've had some time now to study it a little bit. And what we know is actually getting infected with COVID, you also have a risk for myocarditis. And that risk is actually quite a bit higher if you actually catch COVID versus if you get myocarditis as a side effect from the vaccine. I think the CDC is quoting with infection, your risk of getting myocarditis is 0.15%. With the vaccine, it's 1 in 10,000. So we're talking a huge difference in terms of how common it is. The other thing we know is when you get myocarditis with COVID, it's a lot more severe than it is if you get it from the vaccine. So with the vaccine, it's quite mild. Often kids don't need the hospital, might need a little bit of pain medicine to manage that, and it's short-lived.
All right, listeners, we're talking about the potential of COVID-19 vaccine for kids under the age of 12. Pfizer has already actually submitted its information to Health Canada for approval. But, there's lots of questions. We'd give you an opportunity today to get some good science-based answers to those questions. Both our guests today specialize in pediatric medicine. Give us a call. The telephone number is 1-800-716-2221. You could email bluesky@cbc.ca, or you could also tweet us at blueskycbc. Yes, that's it, at Blue Sky CBC. Having a little trouble with our Facebook feed right now, so maybe if that's not working out for you, you can tune in to either 94.1 FM in Saskatoon, 102.5 FM in Regina, or 540 AM across the province. Follow the program on the radio and give us a call at 1-800-716-2221. Email bluesky@cbc.ca or reach us on Twitter at blueskycbc. Again, that telephone number, 1-800-716-2221. Got an email from Susan. We'll deal with this now. Susan writes, my grandson turns 12 in April. Would it be better for him to wait to get the full dose at 12 years, as he's 5'1" and 110 pounds? We're concerned that a third dose might not be as effective. Interesting question from Susan. Dr. Kurji, those children that are sort of on the cusp, what's your best advice for them?
This question came up in our town hall yesterday too. And, I don't have the details of the studies that they've done, but I imagine that they have looked and thought about the fact that kids come in all sorts of shapes and sizes, and that we're trying to find the dose that is the best for everyone. I think it would be safe to get it. I think the safest thing is to get it as soon as possible, because we know that, especially in Saskatchewan, with our numbers being so high, our chances of getting COVID are pretty high. So to protect yourself, I'd say the best is to get the vaccine as fast as you can. Kids who turn 12 this year, you can go ahead and get it now. You don't have to wait till you're 12. But for anyone who's, on that cusp, I'd say go with whatever you can get as fast as you can. I don't know, Dr. Sarda, if you have anything else to add there.
The only thing that we mentioned last time in the tunnel too is that a lot of times your dosing is not just based off the height and weight of the individual, but also immune response, right? And that's a bit different than your height and weight as well. And so they did dose finding studies to find the ideal dose for kids who are a bit younger. But of course, there's always going to be a cutoff somewhere. But like I just echo Dr. Kurji said, that if you have to wait for several months, your chance of getting COVID becomes significantly higher. And so you're better off getting the vaccine sooner where it's available.
I'm curious about concern that many people have, both for adults and children, about the potential long-term side effects of these vaccines because they're new. And you can understand where that legitimate concern comes from. I'll ask each of you in turn, what is the latest research on potential long-term side effects?
I can go first on that if you want, Dr. Kurji. I think that, so one thing that we know when it comes to vaccines in general, this is the case for all non-live vaccines that we've had for decades now and longer, is that the side effects that we see from vaccines arrive early. They arrive in the first days to within the first month or two tops. We don't see delayed onset impacts from vaccines, and that's just because of the way vaccines work. In the case of these specific vaccines, the mRNA that is in the vaccines, that gets broken down by your body within a day. That's a normal process your body does. Your body's breaking down mRNA on a regular basis, and it'll break down this within a day. It'll clean up any of the spike protein, which is the target of this of your immune response from this vaccine, and it'll mop that up in a few days as well. And then all you have is your immune response, which will die down in a few weeks, and then there's nothing left. There's actually nothing left of the vaccine itself in you within a few days, and there's nothing left of the immune response except for your memory of that protein, which allows you to fight coronavirus if you come in contact with it. So there's nothing left in your body to cause a long-term or late onset side effect later on, which is why, Dr. Kurji, you can correct me if I'm wrong on this, but as far as I found, for any non-live vaccine in our history, for the non-live vaccines, there's never been a late onset side effect of any significance that's ever been found. So that's why, we're more concerned about long-term side effects and long-term effects for medications and treatments you take on a daily basis or on a regular basis over a long period of time. But these one and done or two and done treatments, if you get a side effect, you're going to see them in the first couple of months.
I would echo that completely. And what I would add is we are seeing more in the adult world, but also in the pediatric world of kids suffering from longer term effects from the COVID illness. So if you get sick with COVID, you're more likely to have long-term effects than you would be with the vaccine.
Dr. Kurji, the very term mRNA scares people. The very fact that we're dealing with RNA scares people. Can we talk a little bit about that and how those vaccines work and
Absolutely. I'm going to let Dr. Sarda answer. Because Dr. Sarda is the best at this one.
Okay, go ahead then, Dr. Sarda.
Sure. So the idea behind this. So first of all, it's important to know people get concerned with the name mRNA, but it's important to know that the coronavirus itself is an RNA virus. So if you get infected with coronavirus, how it works is that it infects your body's cells and makes your body produce more and more and more of the virus. That's how all viral infections work. They don't, make more of themselves on their own. You don't get two viruses getting together and going on a date and making more viruses. They use your body to make more virus. And so what scientists did was say, okay, well, we don't want the virus to come into our bodies and have our bodies make more virus. What if we took just the small chunk of RNA, the small little stretch that makes a protein called the spike protein. And that protein is kind of the virus's weak spot. It needs that protein to access our cells, but it's kind of out in the open and it is an easy target for our immune system. So our body can use that mRNA or that RNA to make copies of spike protein, which it would do in a viral infection anyway. So just that in a viral infection, you would make the whole virus and it would spread throughout your body. Here, you make a limited number of spike protein that your body can use as target practice and build an immune response. So people get concerned about what this means about DNA and genetics and things like that. But because we're using RNA, that's different than DNA. And your body's DNA is never touched in the whole process. Your body's own DNA doesn't make spike protein. The actual RNA from the vaccine doesn't actually come into the part of your cells where your DNA is. It never actually comes in contact with your DNA or even enters that part of your cell ever. And so it never touches your DNA. It's never a part of that. And like I said, it gets broken down fairly quickly as well. And so that's what I think people have to keep in mind, that this doesn't affect your DNA. It's part of the process of any viral infection, except that we have sort of used just the part of it to create the immune response that we want. The other thing I'd point out is that the amount of spike protein that our body makes from a vaccine is much, much less than an actual viral infection. So you're only making a very small amount of the protein, just enough to get your immune response compared to an actual COVID infection. So that's how this process works. I don't know if that helps clarify it, or Dr. Kurji can add anything to that piece.
No, that's perfect.
Okay, I want to go to the phone lines. We're going to start with Marianne in Saskatoon. Hi, Marianne.
Hi. Thank you for taking my call. I have a question about the timeline for giving shots for children. Way back when we got our COVID shots, we were asked, did you have another vaccine 2 weeks before? Don't get another one 4 weeks after. And I know that's changed, and we can even have both vaccines at the same time, flu and COVID. But I wonder if that's going to be the same for children. Like, should children, I'm wondering, because of their smaller bodies, can they have their flu and COVID at the same time, or should they wait, or should we get them early? Get the flu one now, or what do you suggest?
That is such a great question. And it also comes up with kids who are in grade 6 who are getting their routine shots where public health is going into schools to get vaccine. And I know some families have had some concern about, should I delay my grade 6 shots? Should I, just in case the COVID vaccine becomes available? Our new data says we don't have to wait anymore in between vaccines. It's safe to give them. And it's definitely still safe to do that with kids. If we think about even little babies, when we start vaccines, we're giving multiple shots to kids quite close together, right? So you get 2 months and 4 months and 6 months, and you're getting more than one vaccine at the same time. So their bodies can definitely handle getting more than one vaccine together. So absolutely safe to go ahead. And it's the best protection to go and get everything that you can as fast as you can.
That's excellent. Thank you so much for that information. Thank you.
Thank you for the call, Marianne. Let's move on to Walter in Rosetown. Hi, Walter.
Hi there, Garth. I have a question. I want to know what financial connections these two doctors have to big pharmaceutical companies such as Pfizer, Moderna, and the other
Thanks for your call, Walter. We're going to move on to legitimate questions now, and we have an email here from Kyla. Well, actually, I should allow you guys to respond to that, Dr. Sarda.
It's a fair question. We always provide disclosures anytime we're giving a talk or a lecture or anything like that. I have no financial connection with any pharmaceutical company, including Pfizer and BioNTech or any of the other drug manufacturers that make vaccines or anything else. I've never accepted money from any pharmaceutical company at any point in time. All of my income comes from Saskatchewan Health Authority and the government of Saskatchewan and the University of Saskatchewan.
Dr. Kurji?
Mine exactly the same. No ties to big pharma in any way. No money ever from big pharma. We don't get anything from trying to plug any specific drug product in any kind, whether it's vaccine or otherwise. Okay.
Let's move on to this email from Kyla now. Kyla's got a few questions in here, so I'll give them to you one at a time. She wants to know if there's any long-term data for COVID-19 vaccine for kids.
Yeah. So that comes back to what I've been talking a bit about before, about how we sort of track and how we see side effects from vaccines, and that we haven't actually had late onset side effects or late onset problems with any vaccine before. And there's no reason to suspect this would be any different. Now we've had people who have had the vaccines, obviously for at least closing in on a year now. But if we're going to see anything, we're going to see it in the first month or two, which we saw, for instance, with AstraZeneca, the very low risk of clots, and that came out to about 1 in 10 to 1 in 100,000. Sort of, I think it came out to 150,000 at the end of it. So we can pick up these rare side effects that occur, and that occurred within the first 4 weeks or so. Right. And so that's the side effects we'd be expecting and looking for. There's no biological mechanism, like there's no biological way it would make any sense to get something emerging months later down the line, because there's nothing of the vaccine left in your body at that point in time. So there's no biological way that can make sense. That's different from a COVID infection, because you can have sustained viruses or viral load in your body for an extended period of time, and it can have chronic infection from that perspective. So that's why there's a difference between long COVID or COVID infections and chronic infections from COVID versus the vaccine itself, and how that works differently.
Okay, her next question is the approval being sought from Health Canada on an emergency use basis? Do we know?
That's a good question. I think yes, like it has been all the way along, but I can't say that for sure.
Yeah, I believe that's up to Health Canada in terms of how they determine to provide full approval. Initially, they did emergency use approval for the vaccines which have since been given full approval at that point. And so now that the vaccines themselves have full approval, they've opened the door to allowing full approval, for kids as well. But that's up to Health Canada in terms of what category they put that into.
And
so they haven't given an indication one way or the other yet.
And then her last question here: when will the phase 3 clinical trials for COVID-19 be complete?
So the phase 2 clinical trials for the COVID vaccines are completed. The adult ones completed last year, around October, November-ish or so, which led to the release of the adult data. In winter and early spring, they finished phase 3 trials for the 12 to 15-year-old age range, which is why we expanded that to that age range. And now the phase 3 trials. So the trials have completed for children in September. They completed those trials at that point, which is why we're looking at approval now for kids under 12.
Dr. Sarda, do you know about kids under age 5? Are they still working on that?
Yeah, you're right. Those ones aren't complete yet. They're anticipated to be done sometime this winter, early 2022 or by the end of this year. So the under 6 months to age 5 range is still under trial.
Okay, we've got a question from Jennifer on Facebook. And by the way, our Facebook Live feed is running again. So if you were watching us on Facebook, you can go back now because it's up and it's live. And this question comes from Jennifer on Facebook. Is the vaccine going to be safe for kids with pre-existing heart conditions?
Yes. So in general, absolutely. If you have a child who has a condition that you are worried about, the best advice is to make sure you talk to the specialist that is taking care of that aspect of your child's care. But as of right now, I haven't heard any reason that it would be not safe.
The other thing to keep in mind is that, of course, your risk of a cardiac or heart complication is greater with a COVID infection.
Exactly.
So, yeah.
Okay. Dr. Sarda, I want to put this to you because you are a child psychiatrist. I'm sure you could understand where parents, their main duty in life, right, is protecting their children. You can understand where they might have some concerns about this. What would you tell parents listening right now who, they're not committed anti-vaxxers, but they're not sure?
That's fair. I mean, I'm a parent too. My oldest will fall into this age range of 5 to 11 as well. And, we're pretty excited about being able to get him vaccinated, hopefully very soon. But obviously you worry about this stuff, and it's kind of your job as a parent to worry as well. And that's normal. That's expected. It's a sign that you're a good parent. It'd be really weird if you were a parent that was like, sure, whatever, and not care at all about what you're doing to help your child, right? So I encourage parents to be concerned, to ask questions, which is why we're here to do this and try to answer those questions. I think that the other thing to keep in mind is that we need to weigh out, we haven't gone into this, I guess, which we could now, but we have to weigh out the risk of a COVID infection versus the COVID vaccine, right?
Okay.
And weigh out
Can we
pros
just
and cons.
Let's just hold that thought for just a moment. We're going to take a quick break for a news update, and then, Dr. Sarda, we will continue that conversation. Again, our guests today are Dr. Ayisha Kurji and Dr. Madav Sarda. Dr. Kurji, a pediatrician, assistant professor of pediatrics at the University of Saskatchewan. Dr. Sarda, a child psychiatrist, and again, both based at the University of Saskatchewan. And our telephone number for your legitimate questions is 1-800-716-2221. You could email bluesky@cbc.ca. Reach us on Twitter @blueskycbc. Or if you're following along on Facebook, just put your questions in the comments section. We'll get to them as quickly as we can. And we'll get back to the conversation in just a moment. Right now, Tori Gillis has a news update for us.
Hey there, Garth. Well, in August, the province said it was rethinking its relationship with Extendicare. An independent investigation found that company was unprepared to respond to the COVID outbreak that left 39 residents dead at its Parkside home in Regina. And today, the Saskatchewan Health Authority says it is transferring responsibility of the 5 Extendicare long-term care homes to the province. We'll have more details on that change. That's coming up in your news. Also, a deadline is coming up for workers in Saskatchewan's healthcare system. By tomorrow, they're required to declare their vaccination status, or they can say they want to undergo regular COVID-19 testing at their own expense. As well, the Saskatchewan Health Minister says the province is not asking the federal government for nurses because he says Saskatchewan's healthcare system has enough workers, I should say. We'll have the very latest on what he had to say today as well. That's all coming up in your news.
Thanks, Tori.
Thanks, Garth.
Tori back at 1 o'clock with details on those and other stories. Back to today's conversation. Our guests today are Dr. Ayisha Kurji and Dr. Madav Sarda. Dr. Kurji is a pediatrician. Dr. Sarda is a child psychiatrist, both based at the University of Saskatchewan, and part of a virtual town hall last night about COVID-19 vaccine for kids. They're here to answer whatever questions or concerns you might have about potential COVID-19 vaccinations for children under 12. Our telephone number again, 1-800-716-2221. Our email address, bluesky@cbc.ca. Or if you're following along on our Facebook feeds, you can put your question in the comments section. I'll get to them as quick as I can. Now, Dr. Sarda, before our break, you were about to explain something, and I'll let you go ahead now.
Yeah, Yeah, for sure. I just think that when we talk about parents and weighing risk and trying to decide what to do next, is we have to weigh the risk of doing something versus not doing something. In the situation, there's a high risk for our kids to get COVID. We're seeing a huge percentage of new COVID cases every day coming from a population of kids who aren't eligible for vaccination yet, and hopefully will be soon. And what we know is that the risk from COVID for kids is less than older adults, which is thankful. It's been a great thing that kids have been thankfully less affected as older adults. However, we do know that about 1% of kids who are infected with COVID end up hospitalized. And so on the bright side, if your child gets COVID, there's like a 99% chance they won't have to go to hospital, which is good. But given how rapidly COVID spreads, 1% of kids getting sick is a pretty high number, and it's going to end up being a lot of kids in hospital. And we've seen that in the United States through surges of COVID through youth. And so, so that risk alone, we know from vaccination is risk of side effects of vaccination remains exceedingly low. We mentioned myocarditis being 0.15% risk, and that risk is also for getting myocarditis, which is often mild and doesn't even require coming into hospital, getting any further treatment at all. So we know the risk benefit is still in favor of vaccination, even for younger kids with their lower risk profile. And that doesn't include the emerging data that we're seeing and trying to make a bit more sense of long COVID and more chronic illness related to COVID, which we're still researching and trying to get more data to surround our understanding of.
Okay, let's go back to the phone lines. Melaine, I believe, is in Saskatoon. Hi, is it Melaine? Am I saying that so badly you don't even recognize that I'm calling on you? Melaine in Saskatoon on the phone? Okay. We got some questions from Facebook here. Mitch asks a couple of questions. Do you think that children 4 years old turning 5 will be eligible like 11-year-olds are currently? Any timeline on the next age group? Can either of you weigh in on that?
I don't know yet. I hope so, but I don't know. And I think that'll depend a little bit on what Health Canada finds in the data and how confident they are with that in terms of, do we need to change the dose, which would be the biggest thing, is do those littler kids need a little dose? But I don't know yet. I wish I did.
Okay. Now we've got a few questions and comments here. And sort of the gist of them is that no children have died, or only children with serious pre-existing conditions have died. So why do they need a vaccine? Why do kids need a vaccine? And let's deal with this perception out there that children don't get sick or children can't die of COVID.
So that's incorrect that no kids have died. When I last saw the data, there were at least 3, if not more, deaths for the 0 to 19 age group. We don't have it broken down any further than that. That's just Saskatchewan. Okay. There are absolutely kids dying across the world from COVID. They are not all kids who have pre-existing medical conditions. Besides death, there's devastating outcome that's not death. So there are children who are ending up in the ICU, needing breathing tubes, needing a whole bunch of support. And there's also kids who are suffering from long COVID, right? So debilitating headaches, muscle aches, fatigues. We don't have a lot of data on that yet because it's still new. The last data I saw 2% of kids still had symptoms 8 weeks later. There's huge impact for kids. So from my point of view, anytime we have the opportunity to protect our kids from that potential devastating outcome with something that has a significantly lower risk than getting the infection, it's something to absolutely very strongly consider, and I would absolutely recommend. The other thing about this is COVID, even if you take out COVID respiratory illness and ending up in the hospital or long-term symptoms, if we think about the impact that this pandemic has had on our kids, it goes so much beyond the respiratory illnesses, right? It's the limits on socialization and the limits on activities, and some kids losing caregivers to COVID that we need to think about. And as a community, we know that the more of us that get vaccinated, the faster this pandemic is going to end. And so for the impacts on our kids, respiratory wise, and their mental health and everything in between, I think it really is important that we think about this and advocate for all of our kids to get the vaccine.
I just want to add too that when we talk about, kids with pre-existing conditions, I mean, the other name for those kids are kids, right? Like they still deserve care and protection and safety. And we do a lot to help kids, even at lower risk of severe illness and death. Kids don't generally die. That's considered a tragedy for a reason. We don't accept a lot of death in kids for a good reason. And that's true of all treatments that we do. We spend immense amount of money on childhood cancers, even though very, very, very few kids get childhood cancer. And yet we consider that to be a reasonable thing to treat and spend a lot of money on treating, doing a lot of things in our society to protect kids from all kinds of, from accidents to infectious diseases and so on, because as a society, we don't usually want kids to die or suffer. We want them to be healthy. And so if the risk-benefit profile works out for the vaccine, that's something that we should do to help from that perspective. I mean, polio had a 1% complication rate, and that's considered a slam dunk. Everyone should get vaccinated for polio. So I'm not sure why a 1% hospitalization rate for COVID is somehow acceptable.
Okay, I'm going to go back to the phone lines. We're going to try for Melaine again in Saskatoon. Hi, Melaine.
Hello.
No, there you are. Got you this time. Go ahead.
Sorry, okay. It's a very interesting discussion today. Thank you very much to the doctors. And I think we're all on the same page that we want our children to be safe and no harm being done to them through any medications or vaccines. I'm pro-vaccine myself because I've vaccinated all my children. They're all grown up. They're doing well. And now I have 6 grandchildren. And when I hear that the UK is really pausing this push to vaccinate children because they feel that they know from what the evidence that there's not enough safety data. And that's what all parents and grandparents like myself would be concerned about. And also, if a person gets COVID, whether they're an adult or a child, there are effective remedies out there. And so we don't have to worry that they're not going to make it through if they get severe symptoms. But unfortunately, these effective remedies have been banned, and I just wonder why. Because
what effective remedy? Let's be specific, Melaine. What effective remedy are you talking about? What have you heard as an effective remedy?
Well, the FL Frontline COVID Critical Care Alliance is a very
disreputable.
Is a very reputable. Did you say disreputable?
Yeah, but anyway, I want you to answer my question, Melaine, because we're going to move on real quick. What specific treatment do you say is safe?
These and many other scientific studies have been done. I mean, there have been very many scientific studies done, but I would encourage the doctors here on this program to look into that because there are...
Okay, Melaine, I'm going to ask you one more time to give me a specific treatment for COVID that you believe to be effective that has been banned. Give me a specific example and let our doctors respond.
Sorry, I didn't mean to not answer your question. For example, Ivermectin, which is a Nobel Prize-winning anti-parasitic drug. I'm a pharmacist by profession, retired now, but this drug has been effective for over 60 years. And it's
for
safe and
deworming horses, yes.
Right. And also doctors, my husband is a doctor, he knows that, and many people know that. You've raised an issue that we're going to deal with, Melaine, and we've got a lot of callers, so I'm going to deal with that one issue, and then we're going to move on, okay? Thanks so much for that. Thank you very much.
Thank you for your call, and thank you for raising that. I think I'll put this to you, Dr. Kurji. Ivermectin, it was going to come up.
Ivermectin has its place in medicine. We use it for parasites and things like that. It is not something that has been shown to be effective in COVID treatment. I think I'm going to leave it at that unless Dr. Sarda, you have anything else that you want
I
to
would only add that it's been pretty clear from studies that have been done on it that a good number, actually basically all the positive studies on it have been shown pretty clearly to be fraudulent studies or extremely poorly put together. And that's been published as well. And so we're happy to use any medication that has positive studies or randomized controlled trials that show effectiveness. And I think all physicians are kind of doing that from that perspective. But if it doesn't show evidence, then it doesn't make sense to use it.
Well, Dr. Kurji, what are the potential dangers of, and we're talking about children today, so what are the potential dangers of, rubbing your kid down with horse dewormer or, administering ivermectin to children? What are the potential side effects of that?
Well, I think if we go back to our risk versus benefit conversation that we've been having today, the risk most definitely is stronger than, or is higher than the benefit for anything like that. I'd have to check and see what the risk would be to do this. I can look it up real quick while we're on the phone here, unless Dr. Sarda, you have any thoughts on the specific risks of it.
Yeah, for me, obviously, this isn't my area in the country. I don't use ivermectin for anybody in my field, but at the end of the day, the evidence of benefit isn't really there, and so we're going to go down this route of trying various things that don't have evidence. Whereas we have vaccines that have evidence that would decrease the need to ever need them in the first place. So if we're using an evidence-based approach, I'm going to use the evidence where the data is valid. And there are other, treatments that have been used, again, not in my area when it comes to using steroids in certain people who get quite ill in hospital. There's increasing data about, certain populations getting monoclonal antibodies. I don't know if that's actually been studied in kids though, right? So, and that's an IV treatment. So there's different studies that we're trying to use where appropriate, and follow the evidence to make best treatment guidelines. But if there's not really benefit, you're only really opening yourself up to potential side effects.
Mm-hmm. Yeah, like liver damage, I know is one possibility with an overdose of ivermectin. Yeah. Okay, let's move on to Tom. Tom is in Saskatoon. Hi, Tom.
Yeah, thank you for taking my call. I have just a couple of questions here. And one of the things, now I'd like to direct this to both of your doctors there, but Dr. Kurtze, you've given us a lot of comments, like, for instance, the number of children that have died over the in the world and in Canada. Can you please give us some specific details of studies that have been done and give us the where we can follow that up and actually see those studies? And we've talked about a lot of generalities here, and I'd just like to see specific studies that have been done that I can actually point to and take some confidence in. So I'm hoping that's not asking a little bit much, but.
Are you looking for studies in terms of COVID infection or studies on the vaccine?
Well, the results, for instance, like you mentioned, like there's a number of children have died. Like I'd just like to confirm that with the actual studies that have shown that, right? I guess my second question then is, there's been so much focus on just the vaccine as being, a preventative disease or prevention of this disease. My question is, has there no benefit been given to our natural immunities that we have if we just maintain really good health to the best of our abilities, like make sure that we get enough vitamin D in the wintertime because our skin can't manufacture it, and simple things like that. Adequate vitamin C is, and our children seem to have a greater, ability than we as adults. And I think it's important to keep my health as best that I can and not end up being more susceptible. But is there no credibility given to that?
Okay, Tom, let's let our doctors respond. Maybe we'll start with this idea of building up your immune system.
Dr. Sarda, do you want to tackle that one?
Sure, I can. When it comes to the immune system, so first of all, being healthy is important. Having a healthy diet and having healthy activity, and these are things that are are recommended for anybody. We recommend kids and adults get international units of vitamin D, a supplementation as well. That's all sort of normal in terms of what we would expect people to do. The data in terms of illness is still there regardless. Now, the important thing to keep in mind is that it's not a question of your own body's immunity versus the vaccine, because the vaccine works better if you have a stronger immune system. Like all the vaccine does is prime your own body's immune system. It gives it like a target copy of spike protein to practice against. And we know that people who are healthier actually get more robust immune responses. We know that people who are immunocompromised and have a weaker immune system often need a third dose of vaccine, which is being given out now to certain populations across Canada to give them the same level of protection as other people with 2 doses. So there's this, I feel like there's this trend of either or, like, why do we have to have the vaccine or natural immunity, or serve your own immune system? But really, the vaccine is taking advantage of your own body's immunity and its immune ability to form a defense and be ready for when it faces coronavirus and fights on its own. In either case, it's your own body's immunity that's doing the damage. That's fighting off the coronavirus. I mean. So I think that's what I say about the being healthy piece. It'll make the vaccine work better from our evidence.
And
okay.
I can tackle.
Yes, please.
I can tackle this. So if you're looking for specific data in terms of Canadian data and what risks are for COVID in kids, there's actually a recent study in the Canadian Medical Association Journal, which is across Canada, people pulling together all of the data on kids. So it goes by the acronym CMAJ. And if you look at CMAJ COVID kids, you should be able to find it. And it's a recent study that talks about risk factors, which kids are higher risk, and overall rates and things like that. So that's probably the best study that I would direct you to.
So you could just Google CMAJ COVID kids.
Yeah, it should come up.
And you should find it that way. Okay, great. Let's hear from Lisa in Saskatoon. Hi, Lisa.
Hi. I have a son that is in elementary school, and he's come home and given me some, I guess, COVID myths that he's obviously heard at school. Things like, if I'm wearing a mask, it is going to give me cavities, or like if I wear a mask all day, it gives me cavities, or different things like that. And I'm just kind of looking for some advice on how to combat some of that, because, I've gone online and we've looked at some videos and different things, like saying, okay, no, this is the science behind it. But I mean, he's listening to his friends, and, looking at a dry video doesn't necessarily combat that. And so I'm trying to get some balance, because I don't want him to be starting to go down the conspiracy road of a lot of what I'm hearing from this hour right now.
Okay, Dr. Sarda, I think that's right up your alley. How do you talk to kids about the misinformation they hear?
Well, I think both of us can do this on a regular basis, but I think that it's the first thing to do is, I'm glad that you're so open with your child and that he can come to you and ask you these questions. I mean, what you don't want is them to have all these ideas, learn these things from school, not feel like they can talk to you about them. Right? Kids learn a lot of things at school, a lot of it being accurate and a lot of it being less so, whether it's about COVID or otherwise. And so I think the important thing is just to be able to bring that up. I think I think you've looked and researched and tried to find, videos to try and explain it and present that to them. And I think that's the most important thing you can do. You can also bring it up with your own, family physician or other healthcare provider that's sort of in your life, whether that's a pharmacist or a nurse practitioner or whoever you see for healthcare, and with your child, and have them be a part of that discussion too. We're all available and willing to discuss COVID myths and concerns, questions about masks and vaccines and the illness itself. And I think that's a great way to bring somebody else in to help provide that information to them as well.
Yeah, I would totally agree with that. And the other thing I would say is, if there's lots of different things out there, maybe bringing it up with the teacher to see if it's a chance to bring someone into the class who can help answer questions for the kids, so that it's information that's going to everybody is correct as well.
Yeah. Thank you very much.
Thanks for the call. Let's hear from Dale in Wynyard. Hi, Dale.
Hi, Garth. Thanks for taking my call. We experienced it during the first vaccine rollout for adults, such a patchwork quilt of where to be vaccinated and how to get it done. And then I was really shocked, and I'm sure you didn't mean it. I hope you didn't mean it. Dr. Kurji is who I'm speaking to, because you said two things, something about getting the vaccine for children approved by Health Canada, and then you said figure out how to roll it out. Now, I don't think you mean we're going to wait until it's approved before we figure out how to roll it out, right?
Absolutely. You are absolutely correct. Those processes are happening together. It is definitely not it's approved and now let's figure out how to do this. Those conversations are already happening. I apologize for that.
Okay, I hope that, and I have to stand on a little soapbox about this, because I was given an appointment about 2 hours away from here, from where I live, to have my vaccine, went there, and they had canceled the clinic without telling people. So I really would like for children that we don't have any kind of incidents like that, and we really are well planned to carry it out, whether by family physicians, pharmacies, or standalone clinics. Thanks.
Hey. Thanks, Dale. Thanks for that point. Got a question here.
I would agree with that.
Yeah.
Yeah. Well, that's really a question for the politicians, I suppose, and the health bureaucrats. But all right. Here's a question from Facebook from Cheryl. What about kids with severe allergies with all kinds of triggers? We know that, some people will be allergic to something in a vaccine. How do you know, and who do you talk to?
That's an awesome question. You want to go ahead, Doctor? I can take it as well.
You go for it. Yeah.
I was going to say, so first of all, the vaccine is still okay and approved for people who have other food allergies or who have other drug allergies. There's actually not a whole lot in the vaccine that you can have an allergic reaction from. They talk about PEG as being one of the things in the vaccine, but the rate of allergy to that is exceedingly low. Like we're talking, I don't know how, I think Dr. Shahab once said that he could count on one hand the number of people who would have a true medical contraindication to the COVID vaccine, and that would include allergies as part of that, even though that wouldn't be, so I would say that it's exceedingly rare to actually have an allergy to a component of the COVID vaccine. You can see the ingredients on the Health Canada website to see the list of ingredients, PEG being the one that has been raised, but I think that has I think there's been a dozen cases of PEG allergy in the last decade. It's so exceedingly rare that in that situation, we sort of suggest seeing a physician and seeing an allergist to actually get tested for it. What we have seen is people who have reported allergic reactions to the first dose. One study had them all do second doses, and none of them, even people who had reported anaphylactic reactions to dose one, when they had their second dose, tolerated it just fine. So they didn't even have a true allergic anaphylactic reaction to dose one, because allergies to the COVID vaccines, the mRNA vaccines, are exceedingly rare. So to answer the question clearly, if you have a history of food allergies, a history of allergies to other drugs and medications, are not a reason to avoid the COVID vaccine, because the risk of allergy does not sort of cross that way.
Okay, we're quickly running out of time, but I want to deal with this question because it's one that comes up and certainly has been on fire online. And the question is, can either of you confirm or deny confidently that spike protein does not accumulate in the ovaries, even those of children?
That, Dr. Sarda, if you want to take that, go for it.
You can go ahead. We can both do this one, but yeah.
I think would say confidently it does not. It does not accumulate in the ovaries of anyone. There's some funny myths out there that have come up with similar proteins being in the spike protein and in other things that are involved in the reproductive tract, and they are very different. And it sounds plausible, but it's not. There is no accumulation of spike protein. The other thing that I've heard that's come up is changes in your menstrual cycle, where sometimes all of a sudden after a vaccine, someone's menstrual cycle becomes irregular. Anytime our body tries to create an immune response to something, you can have an effect on your menstrual cycle. If you have stress, if you get sick, you can have a disruption temporarily to your menstrual cycle, but it would even out. It would be kind of the one time, and then everything else should go back to normal. So that is not, and there's no risk also associated with long-term disruption to the menstrual cycle, even if it's in an adolescent girl who is just beginning to have her period.
Okay.
The only thing I would add to that is, sorry.
No, go ahead. Please go ahead.
I was going to say the only thing I was going to add to that is that the vaccine is designed in such a way so that when your body produces spike protein, it actually doesn't go into your bloodstream. It stays attached to the cell that produced it. So it's a bit different than viral infection that way. And so you actually don't get spread of spike protein through your body at all with the vaccine because of the way it's designed. And regardless, you produce less spike protein than you would from an actual viral infection. So there's no concern of spike protein being lodged in the ovaries or anywhere else in the body.
Okay. Well, I feel like we barely scratched the surface on this today, but I want to thank you both so much for sharing your time and your expertise with us. I know that as medical professionals in Saskatchewan, you're probably both pretty busy, so thank you again.
Thank you for having me.
Dr. Kurji is a pediatrician, assistant professor of pediatrics, and Dr. Sarda is a child psychiatrist. They're both based out of the University of Saskatchewan. That's our time for today. Tomorrow, we're going to look at long-term care. That's tomorrow here on Blue Sky. Talk to you then.